Well, welcome everyone to the regular council business meeting for the Oak Grove Community Council on this August 24th general meeting. And I am happy to be here to lead you tonight. Joseph Edge, our chair, is unable to be with us tonight. And our secretary is also unable to be with us tonight. So we are a small group. But with that, I'm going to encourage the board members who are present tonight to introduce themselves. So Jane, do you want to start?
Yes, I'm unmuted. My name is Jane Civiletti and I'm the treasurer and tonight for the secretary also. And I live on the corner of Oak Grove Boulevard and Fair Oaks Ave.
Rich?
Hi, I'm Rich Nippon, and I live 2 doors down from Paul Savis on off of Kellogg and something or other, 3 blocks south of Fred Meyers. I am a general board member and always happy to be here.
Thank you. Mark?
Hi, Mark Elliott, and I live off of Concord Road, just west of McLaughlin, and I'm a general board member as well.
So we're going to invite everyone else who's going to have an opportunity to introduce yourself. And so we ask you to give your name and tell us approximately where you live so that we have an idea about who's here in our community. So we'll go ahead and start with Anita.
I'm Anita Blackmar, and I have the great good fortune of living near Jane and Tom on Fair Oaks Avenue.
And Eleanor?
Hi, I'm Eleanor Hunter, and I live on Laurie Avenue, just south of Oak Grove Boulevard, between River Road and the river.
Welcome. Tom?
I'm Tom Hogan, and we live on the Oatfield between Concord and Thiessen on the west side of the street.
Welcome. Baldwin?
I'm Baldwin Vanderbilt. I live on Neff Road, 3 doors up from Stringfield Park.
Welcome. Heidi?
Hi, good evening. I'm here representing the Oak Lodge Water Services, and I am actually in Jennings Lodge. I live off a Hillside Drive between Rothy, Rothy and Hillside.
Welcome. Nice to have you tonight. Yeah. Suzanne?
Yes, I'm Suzanne Wolf, and I live on East Avenue, which is just 1 block west of McLaughlin Boulevard off of Oak Grove Boulevard.
Welcome. Susan?
Hi, I'm Susan Keel, and I live on Oak Shore Lane.
Welcome. Sarah?
Hi, I'm Sarah Quay. I live on River Road, just north of Nace.
Welcome. And Dave? Dave, you're muted. You want to introduce yourself? There you go. So Dave, we didn't hear you. If you did unmute, we didn't hear you say anything. So we'll, if you get that figured out, let us know, but we're glad you're here with us tonight. And Tom, do you want to introduce yourself and tell us where you live?
Hi, Tom Civiletti. I live on Fair Oaks Avenue at Oak Grove Boulevard.
Well, welcome everyone. We're glad you're here. We're going to begin with some officer reports. So Jane, can you stand in for secretary for?
No.
Okay.
I do know that we do not have any updates or minutes to report right now. So there's not much of a secretarial report, but I will move on to the treasury report.
Okay, well, let's, yeah, why don't you do the treasury report and then we'll go back and do this motion.
Okay, the treasury report stands as it has since April at $1,596.18.
Thank you. So I think we covered the information that you need because you are taking attendance tonight. That was what I wanted to make sure that you had. Okay, good. We have not been dropping anyone from voting membership during the past couple of years. Ever since we were forced to go online, which is a hardship for some people, it felt reasonable not to enforce the requirement that people, the requirements that we had for maintaining their membership. However, as the board has been talking about it, it does seem that it's important to strengthen our council by reinstituting the practice of asking people to attend at least one meeting within 12 months to maintain their voting status. So after they have reached voting status, you only have to go to one meeting in 12 months to keep it. So it's not very much. But at the same time, it's really important, we feel, to encourage new members of the community to participate. And attending 5 meetings before membership does seem pretty strict at time for a voluntary organization with no real authority other than to act as an advisory board to the county. And for that reason, I would like to move that the Oak Grove Community Council, first of all, reinstitute the process for voting members to retain voting privileges, which requires attending at least one meeting in the prior 12 months after gaining membership status, and to reduce the number of meetings that must be attended for a newcomer to gain voting membership from 5 meetings to 3 meetings, going into effect at the beginning of next month, which is September. I also might add to that since changing the membership requirement from 5 meetings to 3, if that seems very difficult to people, we can discuss that. We could put it into place temporarily for 6 months and see if it causes disruption of any kind, but and then and reassess it. Otherwise, the motion is to change that from 5 meetings to 3, again, with the idea that we can encourage people in the community to begin participating as voting members.
And I second your motion, Valerie.
Is there any discussion, questions, thoughts?
Valerie, yeah, I have a question. This is Sarah Quay.
Thank you.
I would love to know exactly where the boundary or the border is. I think I might be closer or might be Jennings Lodge, but I also did some research and realized that Jennings Lodge is not doing council meetings.
That's true.
And I'm a longtime native of Oak Grove. No, I consider myself, again, Oak Grove native. I don't necessarily need to be a voting member. I love participating and volunteering and donating and doing whatever I can for the community. So I would just like to maybe establish what that boundary is.
So Sarah, you mentioned that you live north of Neff.
Not by much. So when I was at the trolley festival working with Jane, it looked like I might not be.
If you're north of Neff, you're in Oak Grove, because I think Baldwin, you can concur with this, is that Neff is the boundary, the southern boundary line, and Baldwin lives on the south side of Neff. But since it's Neff, your backyard, Baldwin, is the line, in that way. So Sarah, if you live north of Neff, you are in the Oak Grove CPO.
Okay. And I might just need to check because I feel like I'm really close to that boundary line. And again, I'm fine with not being a voting member. I just like being able to participate because, again, Jennings Lodge, we don't have a council.
The boundaries are set by the county. And so they're on the county website. It takes a little while to find them, but you can find like CPOs and then there's maps and, I think but they are set by the county. So that might be the best place to get that information. So
if I'm not a voting member, should I not be on the call?
No, absolutely. You're welcome.
Okay. Okay.
Absolutely.
Okay.
And maybe we can annex you in if you're just,
No,
Would love to be annexed in.
You're in the Oak Grove CPO. There's no question. You're in the CPO. If you're north of Neff, you're in it. So
are there other questions or thoughts about the motion that's on the table?
Well,
I wanted to clarify something, just to make it clear that this would be retroactive. So people who have 3 meetings attended already be notified that they are now voting members.
If they've been participating in the last 2 years. We didn't put that in, but we could modify the motion to do that. We had it starting next, just to say it's 3. So if people, if people have been coming and they're at 3, I don't know why we would tell them they can't participate. So,
I would make that amendment to your motion.
okay.
Oh, sorry.
And you know what? I would be a voting member now, based
You would
on
be.
Rich's comment there. I think this might be my 4th, frankly, but I think the 5 was a little onerous. And I think 3 is a good number, and it's open. I mean, let's say Sarah is not in Oak Grove,
She is.
she still could attend the meetings.
Oh, sure.
Absolutely.
Sure. I mean, that's like Heidi. Yes, she's representing the Oak Lodge Water Services, but she's interested in what we're doing here because this is a customer base that we relate to.
Good.
So,
And business owners that are in our area don't necessarily live here, but if they have a business here, they can be part of the council. So that I think that makes perfect sense, Susan.
okay.
Yeah. Oh,
And
anybody
just if I can, I'm Sarah again. I'm happy to just be a participant and not a voting member. I mean, I think I'm kind of on the border, if I remember correctly. Jane, we looked at the map
We didn't.
at the trolley. We looked at the map in the trolley fest, and I don't think I am technically. Maybe I'm not north of. I'm renting. I'm looking to buy in Oak Grove, but I was born here, and I really, really, really love being part of this community. And anything I can do, if it's not even voting, I'm happy to just be
You are.
a participant.
Eleanor, did you have something else? Your hand is up.
I was wondering what is I know that the membership, and since the secretary is not here, I don't think anybody can answer this question. I don't know, but I know that the membership, the voting membership, has goes through cycles on a regular basis. And so I would support this way of getting more people to vote, because again, as you're saying, since it's just an advisory organization, to give people as much opportunity as possible to participate in being on Zoom. So I would support what you're doing. And as you know, Valerie, I've been a longstanding advocate of keep it to 5. So I support your moving it to 3.
Mark, your hand is up. Are you?
Yeah, I just wanted to confirm that this would not change the 5 meeting requirement to be eligible as a board member.
At this point, it would not.
Thank you. That's important. Thank you, Mark, for
This is
clarifying.
just about voting membership.
Well, voting member only. Okay, great. And so the other question is, would this be retroactive back to what date are we going? How far back are we going for this 3 going in 3 meetings? 1 year, 2 years? What? How long? How far back?
I'm open to suggestions. I mean,
Oh, I thought you had said this year that it was going to be 2022.
Yeah, I heard Valerie say effective September 2022 is what I reported.
Yeah.
So I mean, as far as if you've, like Sue has been coming since, I don't know, probably, I don't know how long it's been, but I meant to say if we started in March of 2020, since then you've been to 3 meetings, or January 2021. That's what, how far back do we go as far as the number of times that you've gone to a meeting so far? Does that make sense?
yeah, no, absolutely. Are there any thoughts coming from?
I
People
would
from the
suggest maybe like, January 2021 or something. That's, pretty close to like 18 months.
No, I think that's your objective is to get people able to
Mhm.
vote and participate more fully. So
Yeah. It might be a little bit
and-
hard to actually confirm people going much farther back than that, because I
No.
don't think our records are that complete.
I'd think that's a reasonable timeline. And, I always wondered why you had this 5 meeting. Now, granted, you want people to know about the subjects that they're voting on. But I wondered if there was a sense that there was going to be a takeover or something. And so you wanted to make sure you had people qualified to ensure that that wasn't going to occur. And I think the 3 looks more like people are interested enough to attend and should make it their responsibility to get informed on the issues if they're going to vote.
Yeah, and I, can't speak entirely to that. Eleanor, do you want to speak to that? Because I'm Susan, I'm with you. I have always felt like 5 is way too many.
Oh, yeah,
But
no, five's been there for, I don't know, 25 years at least, more, it's been there for a long time. But I think it's also important to clarify for those who aren't aware of it, is that anyone who lives in this area is automatically a member. They're not a voting member, but they're a member of the council and can always come to the council. It's really just about how many to be a voting member. So, and it was, Sue, that was the idea, was to make sure that people were informed about what they were doing instead of just, hey, all my neighbors, come on in here and vote this thing in this direction. So it was that idea of putting a little time in, seeing what the group is really about, getting a little history of it. So that was it. And I agree. I think you can do that in 3 rather than 5. So, and I will go this far to say this, dealing with the county, it's such a glacial pace anyway. 5 meetings was like, okay, so,
Yeah, all
but
year.
there
Good
is the
point.
desire to, get things rolling a little bit. So again,
Mhm.
I support the 3. So.
If there is not further discussion, can we just call for a vote?
No, I would like you to restate the motion so I can get it down exactly before we call for the vote.
With that amendment of Rich's.
Correct.
For the Oak Grove Community Council to reinstitute the process for voting members to retain voting privileges, which requires attending at least 1 meeting in the prior 12 months after gaining membership status, and to reduce the number of meetings that must be attended for a newcomer to gain voting membership from 5 meetings to 3 retroactively to January 2021.
And okay.
Is there anyone that feels, I don't know, you to say this to be voting status? Voting status. Thanks, Tom. If you are a voting member tonight,
Do you know who are voting members here?
I think people know. If
I
they're
think pretty much everyone on this call is a voting member except for Heidi. Tom Civiletti, you've just attained voting membership. Maybe he's not there.
Yes, I was told I'm now a voting member.
Correct. Okay.
So Sue, if it passes, you'll be a voting member after the vote.
Yes.
You're muted,
I'm
Susan.
right. I won't vote on this, Eleanor.
And we're
You
not just
recuse
voting
yourself.
so Susan can be a member. I just want to say this is for.
All about Susan.
Okay.
All right. All those in favor, can we just do a show of hands or thumbs up? Is there any people that wish to abstain?
Sarah's abstaining. But,
All right, I think that measure passes. Thank you. We've already done the treasurer's update, and I want to thank Kim LaCroix from the county for being very patient. And I didn't have you introduce yourself because I knew you were going to be our speaker tonight. And I'm going to let you go ahead and take over. And you are a co-host, so you can share screen at any time that you would like.
Great, thank you. Yeah, my name's Kim LaCroix. I'm the Assistant Public Health Director for Clackamas County. I think my boss, Philip, has presented to you in the past. I have some slides here that I'll share my screen with you all. Can you see that all right?
Yes.
Okay, so, oops, sorry. So let's see, I'm gonna provide a brief update on monkeypox, COVID-19. I think Joseph asked for some information about polio and then just some time for question and answer. So HMPXB is another way to say monkeypox. It's a little bit less stigmatizing, but nobody really knows what HMPXB means. So either way, I might go interchangeably between both terms. So it's a member of, so it's very similar to smallpox. Right now, there's 2 variants. Fortunately, the current outbreak is the less severe and the less transmissible variant. What monkeypox is not it's not a gay disease, it is not an African disease, and it is not a sexually transmitted infection or disease. That last one is a lot of people do think it is a STI, but it truly isn't, and you'll hear why in a minute. So some of the symptoms of monkeypox are fever, headache, muscle aches. This is followed within a few days by a rash, often on the face or the limbs. And then that rash starts out with flat patches, and then it forms like a firm bump, which then fluid can fill in with pus, and then it can scab and fall off. Usually the incubation period's about 1 to 2 weeks, and then the infectious period is from when the symptoms start until the rash has resolved. So the scab falls off and the skin heals, which is usually 2 to 4 weeks. And this means that those infected with monkeypox have to isolate for usually 2 to 4 weeks, which means if they can't work remotely or can't work from home, that can be quite a burden. It's a little bit longer isolation period than other infectious diseases. Good news is that it's not nearly as transmissible as some other infectious diseases. To give you a little perspective, the Omicron variant of COVID-19 will, if someone has it, it's likely they will impact up to 8 other people with it. Measles, 12 to 18 people. With monkeypox, without any change in behavior, it changes and transmits to about 2 other people. So it's not really that easy to catch, although it still requires a coordinated response to slow and ultimately stop the spread. So this is our response in the Clackamas County Public Health. Of course, we're providing information on our website, via social media. We do, just like with many other infectious diseases, we do disease investigation, which includes contact tracing and case investigation. The health system primarily is doing the testing and treatment, which, unlike the early days of COVID, we do have all these things in place: testing, treatment, and vaccination. And the county does have a big vaccination effort underway in collaboration with Multnomah County. So I'll tell you more about the vaccination in a minute. So in the United States, over 15,000 cases so far, primarily in more populous states. So you can see there's a large number of cases, greater than 500 in California, Texas, Illinois, Florida, New York. In Oregon, so far we have about 141 cases. The average age is 34 years. There are 5 confirmed cases in Clackamas County. There's a little bit over 100 in Multnomah County and about 20 in Washington County. And there's the rest are in those other counties: Columbia, Coos, Lane, and Marion. Most of the cases are in the male population, and most are with men who have sex with men, who identify as gay, bisexual, or queer. There is a lot of intersectionality between HIV status and diagnosis of monkeypox. But fortunately, the outcomes have been pretty good. There's only been 1 hospitalizations and no deaths related to monkeypox. Unfortunately, there is a little bit of a health disparity with a greater proportion of those diagnosed with monkeypox identifying as Latinx, so Mexican, Guatemalan, South American, Indigenous, Mexican, or Brazilian. So we have 2 vaccination strategies for those who are a confirmed case of monkeypox, so they've been tested and they're confirmed case, they can receive a what's called a post-exposure prophylaxis shot at our Beaver Creek Health Center. Those people will be contacted by public health. We can get them in right away to get that shot. And then we also are doing what's kind of called expanded PEP, post-exposure prophylaxis, or kind of for those who are maybe at risk. This is kind of the criteria for that. So I'm not going to read through all of that, but right now, Multnomah County is kind of like a clearinghouse for the region. And so people who either have been exposed, but maybe now they're not a confirmed case yet, or they have high risk behavior, they can call Multnomah County and get on a waiting list for the vaccine. And then Multnomah County screens them for various vaccination partners, including us. And then we will vaccinate them at our Clackamas Town Center location. We do that 2 days a week, and it's about 250 people each day. So it's pretty big numbers. It's primarily Multnomah County residents. About 10% have a resident address in Clackamas County. You might have heard last week there was the first pediatric monkeypox case in Oregon. That, of course, was a household contact. They did not get the virus at school or daycare or community setting. I just want to emphasize that the risk of monkeypox spreading in school or any kind of community setting is actually pretty low, because the means of transmission is really person-to-person direct contact with the rash, the scabs, the fluids of someone with the virus. And it's, like I said before, it's not easily spread unless you have that really long, prolonged, close skin-to-skin contact with an infected person. Does anyone have any questions on monkeypox before I jump into a COVID update?
Actually, yes, I do.
Go for it. Yeah.
I'm wondering if individuals who had been vaccinated about a decade ago for smallpox due to terrorism issues.
Yeah.
I know some public health officials got vaccinations, people in the military. Are they more likely to be protected at this point?
Yeah, that is a great question. I actually don't know the answer. I can ask our health officer. I mean, my inclination is like, yes, that would make sense because the vaccine is pretty effective and does last a long time, but 50 years does seem like a long time. I don't know how effective it would be. I can get back to you. That would be
fun. Oh, that's okay. You don't have to.
Yeah.
I did not get vaccinated again. Thank you.
Okay. Any other questions?
No, that was my question too. I mean,
Okay.
Yeah, the smallpox thing. I mean, that would be, I think, a good piece of information to
Yeah.
generally maybe get out there.
Yeah, no, that's good.
That it does or does not protect people who are at risk on that.
Mm-hmm. Yeah, no, that's a good question.
I do have a question.
Go for
And
it. Yeah.
so with communities that have lower income, how is it being tracked? Just based on going in for a visit, or is it being tracked through the water? Like, how is it really monitored per the region?
Yeah, so there's a couple ways that it's tracked. We are not doing wastewater surveillance at this time, although I've heard that we are pivoting to do that. But really, it's through our public health system. So when providers identify a case. It's a reportable disease, and so it's reported to public health, and public health uses a database and collects that information for the whole state, and then it feeds into a CDC database as well. So really, we're just collecting identified cases that are reported to public health to track the spread of the disease and the number of cases. And then we have an immunization database that tracks the number of vaccines that are provided.
Thank you.
Yeah. Okay, well, I will move on to a quick COVID update. So here's our current case count and death data. So Clackamas County, since the start of the pandemic, we've had over 75,000 cases and 702 deaths. I have to say these numbers are probably underreported, not the deaths, but the total number of cases, especially since we've really switched to more of the in-home testing and not the PCR tests. And often the in-home tests are not reported to public health. This is our case count from the start of the pandemic. As you can see, we are right now in the low risk category. We've been declining for a little while. You can see all the different peaks over time. You know, we were in high risk category not that long ago, and high risk, according to the CDC, is when there's a recommendation that everyone in the community wears a mask. But we are right now at about 400 cases per week that are reported. This is some of the statewide data. So you can see there's about 1,900 cases every week across the state. About eight deaths a week. I'm sorry. Yeah, 8 deaths a week, and then total deaths in the state have been 8,219. Hospitalization numbers are going down. We're in region 1, so you can kind of see, of course, we have a higher number of patients just because we have the bigger cities, but that has been going down as well since some of the other peaks with our variants. Again, right now we're in the low risk level. In the low risk level, the recommendations are to just stay up on your vaccination. That includes boosters, of course. We just got word that this fall, mid-September, the new Omicron booster or the bivalent booster will be available. So shortly after Labor Day, that will be available for folks to get that specific booster. Other recommendations are just, of course, to maintain the ventilation improvements, avoid people who avoid contact with people who have COVID-19. Of course, if you have symptoms, isolate. And, you know, for those who are at high risk of getting very sick, we really do recommend that they talk to their healthcare provider about additional prevention actions. And we're kind of in this new phase of the pandemic, right? When we no longer have a lot of government regulations around masks or social distancing. And that's because we've learned a lot over the last 2.5 years, and we have a lot more tools in our toolbox. So we have a lot more information. When COVID first started, it was a new disease. We had very little information. Guidance was changing all the time because we didn't know. Now we have widespread availability of testing, including the at-home test kits. We have new ways of communicating and assessing risk with the CDC risk levels. We have vaccines available for everyone 6 months and above. We have more monitoring, like we did the wastewater monitoring, and then we have treatments as well. So we've really come a long way in the last 2.5 years, and there are lots and lots of tools in our toolbox, which is, you know, one of the driving factors for kind of lessening of some of the early COVID restrictions. And if you're interested, there's OHA has a 5-point plan for the next phase of COVID-19. So I can send my slides later if you want to look at that, but it's kind of what OHA is working on in the next, OHA and partners, including the county and community-based organizations, what our plan is over the next 5 years. Sorry, not over the next 5 years, over the next phase of the pandemic. In Clackamas County, we're doing pretty good with vaccinations. About 75% of our residents have received at least one dose. 70% have completed their primary series, which is those just the first and second doses. We do have a ways to go with boosters. Only about 42% have received that booster or third dose. We have a lot of tests available to the community, either the at-home tests you can request through the website with Clackamas County. You can request tests through the federal test site, and there is still some PCR testing happening through a partnership with Curative, and there's some drive-through opportunities there. OHA, Clackamas County no longer has their public information line for COVID, but OHA still has one, so we direct people to that line. So on that line, you can report positive at-home tests, you can take a survey, you can ask questions, get information about what to do, and they also have information for schools or long-term care facilities or other congregate sites. We have vaccination clinics around the county. It's not nearly as frequent as it was maybe about a year and a half ago, but we are once a month in Malala at the Methodist Church, every other Tuesday at Canby at the Foursquare Church. We are pretty frequent at the Clackamas Town Center Thursday through Saturday, 11 to 7. And like I said, Tuesday and Wednesday are the monkeypox clinics there. Every other Thursday at Providence Willamette Falls, and then once a month, the second Friday of the month at Sandy Community Center. There are still some wraparound supports and services available for those who are impacted from COVID-19, whether that's due to isolation or prolonged illness. This is some information about that: support for rent, mortgage, utilities, food, emergency shelter, financial assistance. And those are available on our website. Any questions about COVID before I talk real briefly about polio?
I'd like to quickly ask a question about the tests. You know, for a while there, you could order tests and you have them. If you didn't use them, I mean, they expire, and then there was some extending the expiration, or how does that work? And should you just get rid of them after a certain amount of time if you don't use them?
Yeah, good question. Yeah, so I think the original expiration was about 6 months, and then they extended it by another 3 months from what's written on the package. And I've heard that it's going to be extended again, so I would not get rid of them. I would just stay up to date on maybe when those expirations are. I think there's some information on our website about the test expiration. I mean, I think a good rule of thumb is, sure, if it's a year old, maybe get rid of it, but under a year, I think it's still pretty effective.
Okay. Thank you.
Yeah.
Sarah?
Yeah, I was just curious. You mentioned Malala, Canby, and Clackamas Town Center, but is there a way that we could do a vaccination more locally? Is there like a place?
Sure.
How do we bring something more local?
These are all our sites. We would be happy to work with you on doing a vaccination clinic more locally. I can share my information. You can reach out. We could plan something if you'd like something more locally, maybe around the time when the new booster will be available. You have
Yeah, I'm just thinking for lower income people who don't have means of transportation.
Yeah, absolutely. Yeah.
Okay.
I'll put my contact in the chat if you just want to send me a message, Sarah.
Okay, thank you.
Yeah. Okay.
Are there other questions?
Yeah, I had a question about if you have an at-home test and you report it to your doctor, does that get reported to OHA usually by the physician?
It does, yeah. If you report it to your doctor, it is still a reportable disease, and that does get reported into the data that OHA collects. So yes, it does.
Okay. And the other question is, I'm assuming that you can still get vaccinations through pharmacies, Costco, those places, right? Those are all still available.
Yes, absolutely. Yeah, pharmacies, primary care, those are definitely great resources and definitely still available. Yeah.
Is there, when the new variant is available, is that being restricted to certain age groups, or is it to anyone from 6 months up and above?
So we're still waiting for the final approval by FDA and the Immunization Advisory Committee. I've heard both 18 and above as well as 12 and above. So one of those two, I'm not sure. But yeah, most likely, I've been hearing from OHA, it's most likely going to be 12, but we'll see.
And you expect there might be some information on if you've had your second booster like a month ago, you should wait a certain amount of time. There'll be some suggestions about that.
There'll be guidance around that. Yeah, I'm not exactly sure what that will be, but yeah, probably I'm guessing 6 months or so. That's what the difference has been between your primary series and your booster. So yeah, so we determined.
Sarah, your hand is still up. Did you have another question, or is it just the hand still up?
Sorry, I don't think it went down. I'll try to figure that out. Let me lower the hand. Okay, thank you.
Yeah, no worries. Okay, so real quickly, just gonna share a little bit of information about polio. It's been in the news. Of course, it's a picture of FDR who was paralyzed because of polio. So polio is a highly infectious disease caused by a virus. It invades the nervous system and can cause permanent paralysis. It is spread from person-to-person contact. It can spread rapidly through the community. Most people have no symptoms or very mild symptoms. However, about 1 in 200 people, or 1 in 200 infections leads to permanent paralysis and even death. Polio was thought to be widely, or in the US, had been eradicated in the 90s. Recently, it was detected in the wastewater in New York and the United Kingdom. There has been one case of paralysis in an unvaccinated person living in a county with a very low vaccination rate of only 37%. So if you are fully vaccinated, you're fully protected against polio and polio paralysis. If you're not and you reside in a community where that percentage is low, then you could be at risk. And that's what's happened in at this case in New York, as well as the United Kingdom, and the UK is actually recommending a booster for kids because the outbreak is not contained and there is a low vaccination rate. From public health, we're pretty concerned that all vaccinations are down due to COVID-19. That includes polio and other diseases, and it does really leave many communities at risk for outbreaks of vaccine preventable diseases. Measles especially is one that we're very concerned about. In Clackamas County, we do have herd immunity. Herd immunity is 80 to 85% of population is vaccinated. So with polio, 83% of our kids under 5 are vaccinated against polio, and that goes up to 95% of school age kids. So I feel like we have pretty good protection. There hasn't been any cases in Oregon, and we have good herd immunity and pretty good vaccination rates. So the recommendation is really to keep up with all of your vaccinations and just think about public health. You heard all about COVID, monkeypox. We really don't want to have any other epidemics or outbreaks. At this time, we're pretty tired. So Yeah, so that's just a little bit of information about that, but really the risk is pretty low right now. We don't expect to see any kind of polio outbreaks, but it's something we definitely are monitoring. Questions, comments?
Susan, you had a question?
Yes, on polio, though, it's a lifetime vaccination, isn't it? If
Correct.
you've ever had it
Yeah,
100 years ago, you can still be protected. Right?
that's absolutely right. Yeah, that's correct. I think the series is it's 4 vaccinations and they're all done in childhood and they last your lifetime. So, yep, it's not like COVID where you need boosters and there's breakthrough cases. Yep.
I guess it couldn't be 100 years ago. It only came in about 70 years ago, didn't it? That
Yep,
they
yep.
started vaccinating or something like.
Yeah, it was in the 40s and 50s. Yeah, I did. I should have put my history slide on there. It's kind of interesting. Yeah. Any other questions? No. All right. Well, thank you all. I appreciate the invitation and being able to share information.
We appreciate your coming and offering that information to us tonight. Kim put her contact information in the chat. So you can capture that and make sure that people have that and follow up. But we really want to thank you again for taking the time to come and talk with us. Important issues, maybe not always thrilling, but important. So anyway, thank you very much.
Oh, thank you. All right, I'm going to sign off. Take care. Bye-bye.
All right, take care. We're going to move into a land use review moment. Rich Nippon is going to update us with Luart in Joseph's absence tonight.
Well, I'll do my best. There were 2 items that came up that affect the Oak Grove community. We are the CPO, the community planning organization that has the responsibility to advise the Board of County Commissioners. One of the land use planning issues was a proposal to expand the school at the church on Hill Road just off of Oatfield. And there was discussion about whether the morning rush hour might cause problems, and our thinking seemed to be that the county should request a traffic study as part of their planning. And I think that the board is prepared to suggest that to the county planners if the membership that thinks that it's a good idea. The idea is that it may be creating a turning lane or something. It's a busy road. In the morning, you would be adding a lot of traffic, which is going to stop to make turns. And either people going around it or people stopping, it'll back up traffic. Hill Road and Oatfield is already a dangerous intersection. This wouldn't make it any easier. The other thing that we looked at was a proposed variance to create a dog training facility in somebody's garage, about 400 square feet of the garage. It's just off of Oak Grove Avenue, and it didn't seem to have a big effect. And unless some neighbors have anything that they need to add to it, we don't see any reason that we need to comment on it. So I would open it up to the floor if anybody wants to discuss whether we should suggest a traffic study be included in the deliberations for the expansion of the school on Hill Road.
So I had a question on that, Rich. My assumption is that it's the applicant that pays for that.
Probably, yes.
I mean, I'm assuming, so if we say, hey, because I mean, that's such a bad corner. I mean, you can't see. If you're on Hill Road trying to get onto Oatfield, it's, you know, I mean, turning right is even dangerous. So that is a bad intersection. But I don't know how expensive those traffic reports are, so, but
I have no idea what they are. Joseph did give us a lot of information that indicated that the increase in use was substantially enough to recommend that there should be a traffic study. And the county may request it whether we ask them to or not.
right, right, right.
But it is, as you say, a dangerous intersection. There have been accidents at Oatfield. And it only seems to be a problem in the morning when people are dropping their kids off on their way to work.
Mhm.
At the 3 o'clock when they're done at school, if people picking up their kids, it's probably not as big an issue.
Mhm.
And I think that the traffic study is really just done on data that already exists, and then maybe make recommendations.
Yeah, yeah, there's a bunch of really bad sightline intersections on Courtney as it is, and I'm sorry, on Oatfield, I mean, as it is, Courtney obviously being one of them as well, but yeah, so I just think
And
about
it's a
the,
K-12 school, and we certainly want to
yeah,
recommend daycare facilities and that kind of thing
be safe.
for the area.
Yeah.
We don't want to cause it not to happen. We don't want to cause a safety issue by encouraging it.
So maybe that's something that could be put in it, that for safety concerns, we're not trying to create an onerous additional expense for a church, but just, safety really calls for it.
And apparently the church is leasing the space out to somebody who's operating a school.
Still, yeah, okay, thank you for that.
I mean, it's a church school, but it's not run by the church. It's
Okay.
run by somebody that's leasing the space from them.
Thank you.
And it's increasing it, I think, from 80 students to 104 students, and a couple of extra
Staff.
teachers, staff.
Cool. Well, we need more of that child, that age care in this area. We're in a desert in terms of childcare, so schools.
It's a classic government issue of
Right.
trying to get what you want without causing a problem, unintended consequence. So it does demand a study, I think. And I would move that we, send a letter to the board as the CPO suggesting that we think it should be a study. It's not our intention to discourage it. It's our intention to make it safe.
Can I ask Rich, before we recommend having a study done, is it possible to just to have the kind of conversation that says, yeah, I mean, certainly the school and the church are concerned about the safety of the kids too, right? Why would they be planning to do something? So given that the corner is not safe, what is their safety plan? Do they have one? Why can't we ask that instead of asking them to do a study? Because the other question in my mind is, when are they planning to, when was their hope to open this larger school? In the fall?
I'm guessing in the fall. I would think
This year or next year? Because
we're advisory.
opening.
We're advisory, and all we really need to advise is that we're aware of the possible safety issue, and let the county decide how to deal with that.
Yeah. Sarah, did you have a comment? you
Yeah,
wanted to-
again, can I just clarify? Is it the church at the bottom of Hill Road right before Oatfield? Is that the church we're talking about?
Correct. I think it's called Church on Hill or something.
Yeah, that's always been a horrible place to turn. I don't even care if it's the church or not. I lived off of Hill Road for many years. It's horrible.
It's called Faith on Hill.
Faith on Hill.
Yeah, yep, exactly. It's interesting. It would be interesting if the church wouldn't want to somehow incorporate that, because I think they would be tax exempt. Wouldn't it be if it was through the church?
Well, I can't answer, because the church is renting it to somebody who's operating the school. It is a
Right,
church school,
right.
but it's not run by the church. It's run by.
I feel like that would be a good
leases
thing for the
from them.
community in a whole, if there could be some kind of light or something there, because in general, regardless of that church, that's a horrible place to turn.
Well, yeah, I mean, asking for a light might be asking for more than we'll ever get.
Yeah.
But there are accidents recorded there.
Absolutely.
In an intersection, and this would.
I feel like
would
though they could get,
exaggerate what's going on. So, I guess the wording is important. It's why I say we can, make mention that we notice that this is a dangerous intersection.
it's a very dangerous, it is.
Perhaps some kind of a traffic study is in order.
Mhm.
We certainly don't want to demand it. We're not looking to, to be the governing body. We're looking.
Not demand, but we could suggest it.
Right. Our position is to advise.
Right.
Is it a
And-
traffic study you're after, or you're after considering what would be safe there?
What's safe?
Well, what's safe, and probably the way to figure out what's safe is to do a traffic study.
Yeah.
But we don't have to determine that it's a traffic study. We just have to say safety is an issue.
Safety is an issue.
Susan, you have a.
Yeah, I mean, do we know that the county isn't doing an analysis on this? They have some engineer, traffic engineer, who is responsible for developing a plan associated with this. The first thing I'd do would be to ask what their intention is relative to this. And then you can decide whether you want to advise them on the matter. I mean, the fact that there's been a fair amount of discussion about the safety turning there and whatnot would lead me to believe that there probably have been a number of accidents, crashes, and the county has that data as well. The sheriff has that data as well. So this should not be new material for the county. And I'd ask first what their intention is, and then recommend from there.
Yeah, Susan, I think the problem is the clock. We have a certain number of days in which we can comment, and after that, we can't comment.
Comment away.
So, we
I think you could ask a set of questions, in
oh,
fact.
yeah, we can ask the questions, and we can bring it to their attention.
Yeah,
We don't want to tell them how to run the county.
maybe you do,
wanna
but I
tell
mean,
them-
it's.
Well, we want to tell them that we want them to make sure they take safety into consideration.
Well, yeah,
well,
but
so-
I mean, the fact that is high traffic, crashes, safety, blah, blah, then the
There's
question.
also been a numerous amount of homes that have gone up on Hill Road. There's been new construction. So I don't know if that's been taken into consideration. I know there's that whole new development that's been up there now for at least 10 years, but there's tons of young kids that live up there too. So I don't know.
So
Well, Rich's point is well taken, that you've got a limited time to.
Yeah.
come in. But there might be a
Yeah.
whole series of, 3 or 4 questions that you might want to ask.
So
And,
even though the county knows, you're absolutely right, Susan, that there's information on all this different stuff. But without a report, and this goes to Valerie, what you were asking, without a traffic analysis, it doesn't kick into the system to say, oh, something has to happen there. That like the analysis has to reach some sort of number. And if it reaches a number, then it goes to someplace else to like get fixed. And it has to get to a certain height to actually have it put on the list to get attention put to it. And that won't happen unless there's a little nudge that goes under it to say, hey, we're concerned about this. And there's more things like get a traffic report, because that's how you get the county to pay attention to it and have something happen, like the light that just got put up at Vineyard on McLaughlin.
Yeah,
A certain number of people had to die to make that light go up, because there has to be a certain threshold to make that happen on it. That was a state highway. But so I would definitely advocate for strongly suggesting that there be a traffic survey there for the sake of everybody, not just the kids, but for everybody who uses that intersection. So
I think that all makes sense. I mean, I think in my mind, what I'm thinking of is that this is the middle of August. My hunch is they're talking about increasing the school this year, not next. If it's next year, then there's a lot of things that are going to happen. There's already a school running there. To say that a traffic study might be in order or other safety precautions seems like a good idea. So
the timing is on the school, not on us. So
Rich, would you like to alter your motion slightly to indicate some of the conversation we've just had?
Yeah, let me see if I can make that happen.
Okay.
I would move that the CPO advise the county planning that we are concerned with the safety issue of traffic and think that a traffic study might be advised to determine how much might be needed.
To determine the present danger at the intersection.
I don't think the county's going to be interested in determining the
Okay.
present danger.
Right.
They're
Well, could
only going
just
to
to
be
recognize
interested
there's
in-
present danger and there'd be increased danger with more traffic. I don't know.
I like that wording, increased danger.
What, and you might say not just traffic study or evaluation. you
Yeah,
know,
or some
something.
way to ameliorate the issue.
Yeah, yeah.
So if you can make that into a word.
I would second. Did the motion get seconded? Yes,
No.
right?
No, we haven't, this motion is the motion now. So would you like to second it, Eleanor?
Yeah, I'd be happy to second that motion, Rich.
So-
Fabulous.
Is there any other further discussion on this? Are we ready to vote? I think we have a new voting member here tonight.
Woohoo!
Yeah.
I vote yay.
Okay. All those in favor? We can see everybody except Tom and Dave. You can let us know.
Give us a thumbs. There it goes. There's a thumbs up.
Well, even if they vote no, it still passes. So there you go.
Okay, he voted, he's thumbs up. Dave is thumbs up. Okay, good enough. All right.
And the other issue was the somebody wanting to put in a dog training facility in an existing garage that doesn't generate much traffic and doesn't seem to be an issue. We do want to encourage small businesses in the Oak Grove area. I'm not sure that we need to comment on it. But if we want to.
Well, I
somebody
think,
wants to-
isn't it, I mean, I know there's a small business that went in near me and all the neighbors get notified and here's the testimony. And I mean, so it's not just, this topic doesn't come just to this council, it comes to all of the individuals within a
Correct.
certain number of feet radius around that house so that all of those comments get taken into account. So, it's one of those, to me, it's like, if it's okay with the neighbors, it's okay with us. I mean, it fits all the laws and does all that stuff and
Right.
it helps.
No systemic thing
Yeah.
that we've found that is a reason to comment on it.
Yeah, so I'd support it.
Valerie, could I ask, did you get ours on the pump station? Did you notice on that? We're going to improve the pump station that's down here on Oak Shore Lane, our pump station 2,
Mhm.
and improve it in a variety of ways, but for reliability, and it will also buffer some of the noise. So that's just the short course on it, and maybe Heidi wants to talk more about it, but I've been getting, because I'm close to it, I'm getting the notices on it. So I would have thought they would have come to you. And I don't know.
They have, Susan. I've seen it and we haven't discussed it, but I think it seemed like it was moving along
Okay,
towards approval.
okay.
So
Well,
is
I
that-
certainly hope so.
Okay, thanks, Rich, for leading us through Luart tonight. The next, what we have up this evening is a report that's coming from
Anna had a
Heidi.
question. Wait.
Anna has a question, okay?
I've never been around a dog training place, but I just wonder if it involves a lot of barking at certain times when dogs are coming and going.
We got no barking ordinance in this unincorporated area. They could bark all they want.
Something else to, if Joseph was here, we had a map up and we could look at where it was and things like that. That would be helpful, but I think we're kind of limited tonight.
According to the papers that they submitted, it wouldn't have a great effect on noise. It's not that they don't plan a very busy time, and they don't plan to have it outdoors.
So it's training,
Again,
not kenneling. I mean, they're
it's
not,
training, correct,
yeah, so it's more likely to be small numbers than large numbers of.
correct.
And it's not like near a school or a business where there's a lot of UPS drivers or anything like that either.
No, and as Susan pointed out, the neighbors have all been notified.
Oh, okay.
Thank you. Heidi was going to give us a report tonight from the water district, so.
Yeah, so this is actually really brief. We're going to do a more comprehensive update next month in September. And so I think the pump station work that Susan mentioned, some of the other larger projects that we have coming up. So that will be a bigger update. I think Joseph knows, so we should be on the schedule for that. And if not, just maybe remind him that we are planning on a bigger presentation next month. So this was just really quick. I was going to share my screen, but I don't have the rights. So
we can do that for you. If you just want to give us just a second.
It's just a really quick visual. And then I'll post the link in the chat for you. So one of the Clackamas River watershed provide one of the here what we're hopefully that's it.
You should be able to share.
Okay, I'm doing that right now. Sorry. I think you can see the screen right here about Fish on the Run. Fish on the Run irrigation done. So this is just in preparation for the fish runs in September and making sure that we have sufficient water flows in the Clackamas River. It's just a reminder and a little bit of a there's a pledge involved if you want, and a campaign. I guess it's a campaign that's going on to just help preserve some water for the fish runs in September, where they're trying to get you to maybe stop watering your lawns possibly, or restrict the hours of your watering from 8 a.m. to 8 p.m. So I will put the link in the chat and you can go there and make the pledge. And basically you're just putting in your contact information and you'll get sent a nice little yard sign so that your neighbors can see, and maybe that just kind of catches on. So that was the only thing I wanted to share with you guys tonight.
Well, thank you.
You're welcome. I'll stop sharing.
All right. And then Mark, we had a library update.
Yeah, thank you, Valerie. So just a couple of things to bring up. The task force had a meeting just for the Concord School in late July. I don't recall the date, in which we were asked to decide on the configuration of the library, whether it was attached or detached. And so there was a unanimous decision to have a detached library that was not connected with the Concord School. So it is a separate building. So some of the details are now being worked out with the architects. The project is moving forward through the design phase. So that design phase is going to take us into next year. So even though the projects have technically been put on hold by the Board of County Commissioners, they did agree to let the design phase continue. So as far as the Concord School and Library is concerned, there really isn't a delay until that design work is finished. So there is a meeting of the task force that's coming up on September 8th that is open to the public. It will be a Zoom meeting that is being held by the NCPRD staff. So any of you that would be interested to participate in that or hear what, you'll be able to see the latest drawings and development that's been being done by the architect's office. So that would be a very interesting meeting for some people that are interested to see how that design is progressing. They've gotten a lot of input from folks about their design issues so far, and we're all interested to see how they've moved forward and incorporated some of the ideas and issues that have come up from the community. You may also know that there has, this is, I think Anna is going to speak a little bit more to this, that there has been discussion recently about devoting a certain amount of money from the ARPA funds that have been made available to the county to be devoted towards the cost of the library project. And so that has been under discussion with the county board or with the commissioners. They will also be meeting on September 8th to have a discussion about how those ARPA funds are going to be allocated to the 8 or 10 projects that are on their to-do list that go all the way from the new courthouse all the way down to the community college extension. So for those of you who are interested in that, I think I was going to speak more about this. There are opportunities for you to engage in the library design and also to speak about your interest or the importance of making this a priority with the county. So I'll stop there, and Anita, if anyone has any questions, I'd be happy to answer those. And I know Anita has some things that she wanted to bring up as well.
Eleanor, did you have a question for Mark?
Well, I do. I sort of general, one of the questions that I come up with is the really basic one of, okay, we all pay a certain amount of taxes towards the library. How much of that is actually used to operate the very inadequate library that we have? My understanding is like there's an overage, and like I have concerns about the safeguarding of the funds, basically. I mean, with all the craziness that went on with Gladstone and these different things, just I think that would be a really helpful thing for people to explain or mention, you know, when different reports on the library are being provided, to just help clarify that, because I think a lot of people aren't aware of that those are specified funds for the library.
Right.
You know, for the operations and the maintenance of it, and that the building of a new one is a different funding chunk, and help people understand some of those dynamics without getting too much into the weeds. So I think just in general, that's helpful information. So that thought.
Yeah, what if you like, I can say just a little bit that the tax assessment that we have is for the maintenance and operation of the library's district. So it does not go towards construction, although the library has been able to keep back, I think, close to $5 million that they have in reserves that can be allocated towards the construction of the library. So the construction monies some of that will come from there, and the rest of it will come from the county or other fund or other sources.
Thank you, Mark. Anita, did you have?
I can pick up where Mark left off if you'd like. So over 30 years ago, the Oak Lodge Library was set up in a nondescript rental building on McLaughlin that has no green space outdoors, and most of the available parking is at a distance and not easy to identify. 14 years ago, voters approved a measure to upgrade our Clackamas County library system, and volunteers on a library task force, a library advisory board, and the county staff and the architects all agreed that a new, bigger building in a park setting would be ideal for replacing the outmoded substandard library in terms of ambience and in terms of expanded services, more events, better meeting rooms, and a larger circulating collection. Once the search for a location was on, it was concluded that the former Concord school site was the best option and the right location for a trio of amenities, a park, a library, and a community center. When construction and labor costs rose rapidly recently, the BCC put the construction of the two library branches on hold for up to 1 year. But as Mark said, the design work is ongoing and is guided by the amount of funding that's allocated. The library has much of its needed funding already in hand, comparable to the funding needed for the new Leading or the remodeled Oregon City libraries. Some of it is state ARPA money, which will time out sometime in 2023 if not used. And then there's a great deal more ARPA money, which is county ARPA money, and that's still in play. So now is the time to urge the BCC to consider the library as one of the projects for this county ARPA money. On multiple occasions, county staff have publicly stated that additional funding will come from the county general fund. But Chair Smith has recently suggested that people in our community aren't very interested in this library going forward because so few attend BCC meetings, testify, or write in about it. So now there are some people in the community who are worried that the new library project might go by the wayside and peter out. The BCC has not heard a strong, clear message lately from the Oak Lodge community about how important this library is to us. I think the last thing they heard from the two CPOs was about separating the library at Concord from the school building so that it could proceed with its own independent funding and timetable. But that was many months ago, separate from what Mark was discussing about the location, the general sense of a location of the separated building. So now we need to affirm our enthusiastic support for the design process to continue based on suitable funding and for a timely beginning of construction. As the first amenity to be fully developed at Concord, this library will establish a community heart, a sense of place, and a community identity. I think it will be a joyous day when residents first visit this modern new library. I think it will feel like a coming of age for this area. So tonight I'm requesting that the OGCC add our voices to the voices of others in the community, urging the BCC to recognize how important this long overdue library is to us and urging them to fully fund it by various means, which may include the general fund and ARPA dollars, therefore fulfilling the library settlement agreement. One option is to testify before the BCC on September 8th. That makes a big impression. It's a morning meeting. I forgot it. I think it starts at 10 or 10:30. But I also have a motion that I would like us to vote on tonight. And I move that because of the exceptional value that the new Oak Lodge Library will provide for all demographics in our community, the OGCC affirms its strong support for the BCC to fully fund and develop in a timely way a new Clackamas County Oak Lodge Library branch at the Concord site to replace the Oak Lodge Library on Southeast McLaughlin Boulevard.
Do we have a second?
Second.
I think we have second, thirds, fourths, fifths. Anyway,
Whatever.
okay, yes, we do have a second. Thank you. Are there any questions or thoughts about this? I can't help but just say, you mean the community hasn't kept up all of their energy for 14 years?
Yeah, right. Yeah.
It just, okay, all right.
Okay, right, 14 years. Okay, so my concern is the idea of when you say fully funded, and then there's the design is going to be altered by how much funds are available, right? And I just feel like there's this like quagmire of like, well, wait a minute. There was this impression when the first design thing went through, it was like, don't worry about money, just what do you want? Here's how we do, all this different stuff. So the community has been led to expect this thing and then it goes away. And then how much money? So it's that idea of, fully funded to what number that the community has already said, like, we want a library that's this big, that has this many amenities. I mean, to say fully funded leaves it too, I don't trust that. It's like, what's an actual number that we know? It's a $7 million library. It's a $14 million, whatever it is. It's like, what's that number that gets this community a library that is the size and the stature and the service quality that that the 28,000 plus people in this area deserve to have by whatever the library standard measure is, not the county's decision as to what they think it should be funded at. Because I can't throw a brick that far. That would be my comment.
Oh, you've certainly identified the big issue here because of a couple things, because costs are rising for construction. And so what used to seem like fully funded,
right, you wait 14 years, cheapers, so sorry.
Yeah, and there have been skyrocketing construction and labor costs recently that just ramped up really fast. Mark, would you like to weigh in on this question?
Yeah, I think, Eleanor, you've got some good points there. I would mention that there is a program that's been developed for the library, which constitutes a certain amount of square footage. And one of the reasons that the task force came together in July was to give clear direction to the architects to proceed with a specific design. And in the world of architecture and owners who pay for that, once an architect starts doing something, you really don't want to change your mind because it ends up costing a lot more money. So my feeling is that the architects are moving in that direction with the program that was approved and like 2 years ago. So I think the purpose, I think, of Anita's motion is that we don't want to get to the point where the design is finished and then the BCC says, well, we don't have enough money to do it, so we're going to do the Gladstone one because it's cheaper. And I would say, by the way, that I've heard in testimony last week with Chairman Tootie Smith say that, and I hope I'm correct on this, that the Gladstone agreement is in relation to the Gladstone Library, not the Oak Grove Library, and that they have a commitment to build the Gladstone Library, but it's kind of loosey-goosey about the Oak Lodge Library, which made all the hair on our heads kind of go up and like, well, what the heck do you mean by that? Because I think there is a fear that the Gladstone Library will move forward, but the Oak Lodge Library will not. And so I think this resolution is intended to ask the BCC to make the library a priority along with the Gladstone libraries, that they be done at the same time with the same idea of being completed and in the similar time frame. So I guess that's what I would add. Hope I caught that right, Anita. Yeah.
Thank you. Thank you very much. Yes. And as you mentioned in a text to me, if the same contractor is working on both projects at the same time, that it's a money saving, cost saving. But I think you guys are bringing up really good points. And so I'm wondering how to amend the motion so that we communicate our enthusiasm for this going forward, but we also don't leave it too loosey-goosey about what we are asking for in terms of funding.
Well, I think also, Anita, it sounds clear that this is one of those moments where it's sort of a all hands on deck, as many people who can write a letter, testify,
Yes.
send anything in. This is one of those moments where it really does make a difference at the BCC, the amount and the number and the diversity of people they hear from. If it's the same, 5 people, they're like, yeah, those are the same 5 people, and they discount it. But if there's this upswelling and this point, they're like, oh, wow, okay. I mean, the BCC really does notice how many people communicate and how many people like write in for this kind of thing. So I'm hearing 2 things. One is the motion for this group right now, but also the really intense importance for on that day to swamp them with as many things as possible. And how is it that all of us might be able to help or participate in that? Because it can really help change things. So.
Yes, thank you for that. Yeah, thank you for pointing out that it needs to come from a lot of different organizations, not just the OGCC. It needs to also come from individuals, but organizations really add a kind of oomph to the whole thing because they represent a lot of people. And but I certainly wanted to get this motion, if possible, passed tonight, because then we won't meet again until after a critical date, which is September 8th.
Could I make a
So-
suggestion, Anita, that?
Certainly, please.
Could we make the motion that we will have the board of the OGCC work with Anita to create a letter of strength regarding the library to go. And Joseph is an excellent letter writer,
Yeah,
and
I know.
work
Yeah.
with him. But
Yeah.
if this group trusts that we go forward that way, then we can have that.
Absolutely. I second that motion.
Oh, that's beautiful. And the
Yeah.
timing of that would be before September 8th. We could
Right.
October.
Right.
Oh, fabulous.
Yeah.
Oh, that would be excellent.
Right, because then you don't have to
Um,
word craft in this meeting, which never is going to work out. So, yeah,
Yeah.
great idea, Valerie.
And I think what we did in previous iteration was that I gave public testimony at the meeting with the approval of the community council to speak on their behalf.
Yes.
So I think that's I think a letter writing is very good, and for us to either to allow Anita or myself or whoever to
Yes.
speak for the board for the
Yeah.
community council
Yes.
at the September 8th meeting. I think that gives weight to it, and I'd suggest that.
Oh, that's brilliant.
Jane, did you have?
Yes, I'm asking Anita then if she's withdrawing her motion and the second that was made.
Mhm.
Yes, because there's a new motion
Okay.
that,
New motion was made
Valerie,
by-
are you allowed to make the motion because you have it clear in your mind?
I think she is. She's not the chair. Just
I'm
chairing a
just, I
meeting.
am chairing tonight.
You're
So
chairing a meeting, yes.
I move
That's okay.
that we ask the chair of the Oak Grove Community Council to work with Anita to create a letter of support for the library. Period. And we'll make it as strong as, can that way.
And that we authorize Mark Elliott to speak and testify on behalf of the organization.
Yeah,
on
I mean, we can make
September
that two separate one,
Make it two separate.
two motions, or we can make it at one. We could do the letter and authorize Mark to speak on our behalf, or Anita on our behalf, or both of them on our behalf.
Yeah.
Sounds like a one motion reaction to me.
We're going to
Okay.
support the library. Yeah. I second that.
Okay,
Any other discussion about this as our time is railing on?
I vote.
All those in favor?
Tom,
Tom, Heidi,
Baldwin.
there,
there we go. Sarah, cool.
There's thumbs up. Okay.
Baldwin, where's your little thumb, darling?
He might not be there. That's okay.
Well, it'll pass anyway. Okay.
all right. Thank you very much.
Thank
Thank
you,
you.
everyone.
Thank you.
We're running on time. Suzanne, did you have an update from HDOG that you wanted to give tonight?
Sure. I would just like to let everyone know that tomorrow at 2:00 at Awakening is the HDOG board meeting for this month. We have two guest speakers planned. One is Mike Schmier with the Oak Lodge History Detectives. And he's also invited Craig Kuntz, who is residing and also remodeling the Charles Risley House, which he owns. And both of them will be sharing information about historical markers or plaques for buildings, since HDOG has expressed an interest in that with him. Also too, Eleanor Hunter will be presenting. I'm just going to let you know that she has a great idea brewing in her head that she shared with me yesterday. So she would like to share that with the whole board as well. And then of course we need to take time to think about the upcoming Halloween event and possibly a Christmas event as well. And then other than that, with respect to the letter for the library, the letter of support for the library, I will approach the board about doing that as well, and having that ready for September 8th. And I think, yeah, oh, did I mention that we're going to be at Awakening? We've been, yeah, and so that will be 2:00 tomorrow. Thank you.
Thank you, Suzanne.
Mhm.
Are there other updates for tonight that need to be given? You, okay. For announcements, I am going to see. here.
Mark has his hand up.
Okay, and I want to. just gonna
So
show
this isn't an update, but I guess maybe it's a question, and I hope this is the right place to ask it. There is a neighbor here on Linden Lane who has a perpetual garage sale. I mean, they're running a business out of their property. Every week they have a garage sale. And the folks that I know that live nearby are very frustrated with that, but they do not get any action from the county because not enough people say enough to make it rise to the occasion where the county will cite them.
Exactly.
So I'm
Exactly.
curious about how we as a council might be able to address that. And I don't want to make a big long discussion about it, but perhaps something that the board can talk about for next time about how we might address that with the county.
Sounds like a plan, yeah. Bring that up. Maybe we can research some information before that happens as well.
There is information already. Can you not screen share, Valerie? We have had this discussion at community council meetings in the past, and there are restrictions and rules within some policy area of the county about how many yard sales are allowed at a property within a certain period of time. And so there is something on the books already. The county would need some form of proof that this yard sale happens over and over. So it would be a neighbor taking a photograph on this date. Here is a date, there's a yard sale. Here is this date, there's a yard sale. And if they get enough of that information, then they would have to act on it and cite someone.
The other piece is you have to have, I know for code violations, you have to have 3 different times. You have to have 3 different people complain. Because even if the person who it's their job and they see code violations on their way to work, they cannot stop and address those code violations. I think it's 3 different people have to write in or contact them about the same thing for it to raise to the level of getting any attention. So you can't just have like one annoyed neighbor saying, oh, those people are awful, which is fair.
Would it,
that can
would
happen.
it not,
You
would
have
it
to have-
not also be around parking?
You could go there if you want to, but there's, as Jane says, there's certain requirements that are already on the books. And if it violates that code and enough people complain, you could also call them or ask them what would constitute appropriate documentation to verify that this is happening, so that you know from them, this is what you told me, this is what I have to do, because so they know you're serious and you're going to do it. And you say, okay, let's have 3 people stand there and do it. And you orchestrate it and you make it happen to get it to the point that they'll pay attention. At least that's how we've done it in the past.
Okay, great.
Yeah, it's a new county.
All right,
Okay.
I'm going to screen share again just so that I can get these dates right.
Where is that garage sale place?
Yeah, sounds great. Yeah.
It is on Linden Avenue. The address is 15209 Linden Lane.
I'm not wanting to go. I'm just,
Sure.
No, but I think that's
Yeah.
great because
So-
there's been 2 of similar that are on River Road near Jennings Lodge as well. That
Mhm.
happen all the time. And it becomes, in my mind, a parking issue because the bike lanes get blocked.
Right. Safety.
Mhm.
So the one on
Mhm.
Linden Lane, there'd be very little traffic, and that would be south of Oak Grove Boulevard if it's 152 something.
Right, it is south, right, just as Linden turns into Creighton.
Mhm.
It's just their entire yard is turned into a,
Mhm.
Mhm.
garbage dump.
So I'm gonna move us along, and I apologize, but I have people gathering on my porch. I had not planned to chair tonight, and so our meeting is going long, and I am going to need to bail any minute.
Great.
I'm sorry, but our future meetings are I've got them on the screen right now. Our next meeting will be September 28th. And the next public board meeting will be on October 3rd, and those links are available on our website, the Zoom links. Are there any closing announcements tonight, and then I will close the meeting, but I will leave you all on and that you can chat as long as you like. I will stop recording when we close our meeting. So any
Thanks for,
final,
thanks for stepping into the breach, Valerie, and chairing tonight.
Thank you.
And Jane, thanks for standing in as secretary. So,
all right, I am going to end our meeting.
good night, everyone.